Welcome to What's Happening at Tri-City Medical Center. This episode features Dr. Jason Curry, who practices physical medicine and rehab at Tri-City Medical Center. Dr. Curry specializes in non-surgical approaches for the treatment of cervical, thoracic, and lumbar spine pain, as well as joint pain. His goal is to help restore physical function and activities of daily living by improving the quality of life for his patients. He joins us today to talk about spine and joint health. Welcome, Dr. Curry.
Thank you, John.
Let's talk about something that I see in your hand there, I'm going to guess, is a spinal cord stimulator. How does that work?
So a spinal cord stimulator is sort of like a pacemaker for the heart. It's a pacemaker for the spine. And so I brought in a spinal cord stimulator, some demos here to show everyone. This is a spinal cord stimulator lead. It has little tiny electrodes at the tip of these leads, and these leads can be implanted inside the spine, and you can turn the device on to scramble pain sensors in the spine to take away someone's pain. Particularly if that pain is a burning type pain in the leg or foot, this works really great for that. It replaces that sensation with the buzzing sensation that's painless. Or depending on the type of frequency that's programmed into this device, sometimes it takes away the pain completely without a buzzing sensation. And so I brought in a spine model as well to kind of demonstrate this. These are the leads again, and they get placed inside the spine, and they run up inside the spine. And at the top of the spine model here, you can see these spinal cord stimulator leads placed inside the spine. And these are the leads that get turned on to scramble the pain.
Is this a type of surgery?
It is. It's a unique thing in that there's typically two parts to a spinal cord stimulator process. It's very unique in that there's something called a spinal cord stimulator trial and then an implant. With the spinal cord stimulator trial, it's sort of like test driving a new car for the week, and then you take it back to the shop a week later and decide if you want it or not. So with the spinal cord stimulator trial, these leads, through the assistance of using needles, are actually placed through the skin and inside the spine. And then the leads are taped down to the back and plugged into an external battery that someone will wear for the week. And they go home like that for a week and get to try out the device. During that week, a representative with the company that makes this technology will be in contact with the patient. And there's all sorts of programs that they have a laptop that they can use to program the electrodes individually. And their goal is to hopefully take away that patient's pain. And so during the week of the trial, it's unique in that the patient gets to try it out and decide if they like it or not. A week later, they'll come back to the office to see me, and at that time, the leads will slip out of the back in the office, and the patient will get to decide if it's something that changed their life significantly, and if so, then we'll schedule them to have it implanted. Or if it doesn't help a whole lot or they didn't like how it made them feel, there's no strings attached. The leads come out and we just don't implant.
How long has this treatment been available?
It's been around for a good 50 years, but over the last 10 years, they've made remarkable success with technology. These leads now, there are several different companies that make this technology, but some of the best technology that's out there will have the ability to scramble each individual electrode to scramble away the pain, as well as MRI compatibility.
So how does this actually work? Is there a controller that you have with it? Do you decide as the patient when it's needed?
Right, so if a patient has this device implanted, they get a remote control to use at home, and I brought in a remote. So this is a typical remote. It's sort of like a small TV remote, and this remote can turn the device on or off. It can adjust the type of frequencies and the type of stimulation being provided inside the back, and so the patient has the ability to basically have the controls in their hands.
Is this something that stays on typically almost all the time, or just a couple minutes a day, or could it be anything in between?
It can be anything in between. There are some safety issues such as driving. We wouldn't want you to have it on while driving. But in general, someone can have it on as much as they want. And again, they have the controls at their fingertips.
Now, do you have to be tethered to power, or is it, does the battery give you significant freedom?
So the battery during the week of the trial is external, and so it goes on to a little pack that the patient wears for the week of the trial. If they decide to have it implanted, a battery will be implanted underneath the skin, and I brought in an example of a battery here. So this is a very small battery. As you can see, it fits into the palm of my hand. This battery is a rechargeable battery, and so it can recharge through the skin, sort of like Bluetooth recharging technology. Depending on how often someone uses this machine will depend on how often they need to recharge it. But the charger just is placed right up against the skin where the battery is inserted, and it charges through the skin. And there are also non-rechargeable batteries. If someone is worried about having to recharge it, we can place a non-rechargeable battery on the skin as well.
How successful is this in your experience?
In general, if a spinal cord stimulator is placed for the right reason, it's very, very successful. And that's, again, an advantage of this whole system overall, is that going back to that trial where you get to try it out for a week, and the patient then can experience what the device feels like, and then they'll be able to make an informed decision if they want to have the device implanted or not.
Now, at the beginning of this, I think you said the burning pain symptom is an indicator. Is that how you know if you're a candidate for this, or is this something that takes deeper investigation before you would recommend it?
So in general, a spinal cord stimulator is done when all other conservative treatment has been exhausted. So we want to make sure someone's had physical therapy, medication management, perhaps injections. We want to make sure all of the more simpler things have been done before they go on to have a spinal cord stimulator system. There are different diagnoses that qualify for a spinal cord stimulator. If someone has burning pain in their legs, that's a very good reason to have a spinal cord stimulator if they are a non-surgical candidate. And again, the question of a stimulator can be complex depending on if you have a herniated disc that's causing your pain. Perhaps addressing that herniated disc is the better way to go without a spinal cord stimulator. But it's not, spinal cord stimulators are not just done for pain due to the spine. We actually see a lot of success in other areas of medicine, such as, I can give you a couple examples, some patients in general that I've treated. I saw one patient who had a history of hip surgeries, and this patient had a lot of burning pain in the side of their hip that kept this patient awake for many years. They were unable to sleep and get a good night's sleep. They were sent in to see me for evaluation. I talked to them about this treatment option, and this patient did wonderful with the trial, and the patient went on to have an implant, and they're very, very happy now, able to sleep through the night and do the simple things of life, which made a huge difference for this patient. Other areas that it can be used, peripheral neuropathy. So sometimes people have a severe burning pain in their feet that's not responding to medication, and they exhaust all other treatment options. I've seen this done for peripheral neuropathy. In fact, one patient had a 95% improvement in their peripheral neuropathy, and they were able to get off of all their pain meds. So
is this covered by medical insurance, by the way?
It is. It's covered by medical insurance.
Well, that is great news, great information. Thank you for joining us.
Thank you for having me. I appreciate it.
And thank you for watching. For more information on spine and joint health, please visit tricitymed.org. You've been watching What's Happening at Tri-City Medical Center. This series will keep you informed about health issues, events, and services at Tri-City Medical Center and provide you with information for a healthy lifestyle. You can view past episodes on video on demand by visiting koct.org. We'll see you next time.